Green Screen Plastic Surgery, episode 2. So today's episode is about a breast lift, also known as a mastopexy. So number one, who is a candidate for a breast lift? So if your nipple is at or below the fold, or if most of your breast tissue is below the fold, then you are a candidate or should at least be thinking about getting a breast lift. So there's 3 main options to a breast lift. We can lift the breast and add an implant, we can lift the breast and add fat, or we can just lift the breast without adding either one of them. So what's the best option? Well, it all depends on what you're looking for. So when a breast is lifted, I have to remove some skin and some breast tissue. If we had an implant, you basically can pick the size that you want to be. If we have fat, I can increase the size by about 1/2 cup to 1 cup, but that's about it. So let's look at this patient. So if you look at her nipple, it's below the fold and a lot of her breast tissue is also below the fold. I did a breast lift and I added an implant because she wanted a lot more fullness and roundness to her breast. So I moved the nipple to a higher position. I placed an implant behind her chest muscle. And I also did an internal bra to give it extra support and roundness to the breast, as well as enhance the cleavage. So this is actually during the operation, and I've done one side and you can see her natural breast that has the sagging on the other side. Just look at how much elevation we can get with that nipple and bringing the breast up back where it used to be. And that fullness that you see at the top, that's just not something you can get with just fat grafting alone. Here's another patient. Did the breast lift, I added an implant. She also had a tummy tuck at the same time. Super common to do both of those procedures together. And this is her during the operation where I've done one side, haven't done the other side, and I also haven't done the tummy tuck part yet. So this is an example of a patient who had a breast lift with fat grafting, no implants. So after I did the breast lift, I liposuctioned her abdomen and waistline, injected that fat into the upper part of the breast. She wanted her breast higher, but she didn't want it to be any bigger and just wanted to prevent that scalloping at the top of the breast. And just to show you kind of a comparison, this patient had a little bit larger breast and she wanted to be higher, but she didn't get the fat grafting at the top of the breast nor an implant. This is a result that's after about 12 months. So this is still an amazing result. Her breasts are so much higher, but she's still missing that fullness of the upper part of the breast that a lot of people want. So what do most people choose? They usually choose a breast lift with an implant. It's just more definitive. You can actually pick the size that you want, and it gives you just a lot more roundness and fullness and shape to the breast. The second most popular choice is the fat grafting, probably because we can liposuction an area of stubborn fat somewhere else, and instead of throwing that fat away, we inject it into the breast. Anyway, we'd love to see you here at Augusta Plastic Surgery, and we can talk about which option is best for you. And I'm Dr. Ewart, signing out.